Thank you very much. Perhaps the first minute or two, I can just share without the PowerPoint so that I can walk through the product that we have. So essentially, we do a portable medical imaging, and it's really quite simple. We do two things. We do diagnostic screening, so for early detection, so that you don't have to wait for a year before you know potentially you have certain diseases. The second thing we do is chronic disease management. So once you know you have something chronic, how do we manage those so that it doesn't deteriorate? So that if it's recovering, we keep doing the same good things that we're doing. And those are the two segments that we're looking at. And right now, we're mainly looking at three organs. We're looking at lungs, liver, and kidney, and we're doing more in the coming year or two. So the way it operates is quite simple. So in here, we have our imaging device. It's really quite small. It's designed to be home-based so that you can essentially use it at home. We connect this to the internet. So via this, we go to the cloud. We have machine learning algorithm that feeds back to your app. And essentially, you can control everything, including seeing the results and recommendations within that itself. So other than connecting to the internet, we also need to connect to the sensors. And these are the sensors that we have. So essentially, we're doing a cross-sectional imaging, meaning that wherever we wear the belt, we wear it, we scan the region that we're wearing it on. So for example, if I want to scan my lungs, it has to touch the skin. But the way we do this is simply just wearing this around here. So in here, we wear it for 5 minutes. There's no radiation. It's really quite safe. We walk you through via the app, and we can do lung scanning. And then a bit lower, if I wear this here, it's liver. And even lower, this is kidney. And similarly, we can do it in quite a lot of different places. If we make a smaller black band, we can do sports injuries on tendons and other things as well. So now I will go to the slides to walk through a bit more about the device that we have. Yes, thank you. So in here, so as we said, we do diagnostic screening and chronic disease monitoring. And this is it. Wear it around, and it's very fast imaging. So every second, we take around 30 to 200 images. So it's almost a video. That enables us to look at quite a lot of different things. The way I mentioned functional includes the time domain as well. So when we're looking at lungs, we want to look at lung function, and then because lung function almost always depends on how your lung moves and how you breathe. So those time domain analysis is really helpful to us as well. And the other thing about functional is that we shoot in different frequencies of signals inside. So across different frequencies, the electrical properties of those tissue that we're looking at has a bit different as well. So based on that, we can guess whether inside your liver, how much fat is there, how much normal liver tissue, and other things could be there as well, as an example. So mostly, we're looking at things that has a conductivity with a low level that we can look at. So it's mostly soft tissues that we're looking at. So edema, inflammation, fibrosis, fatty tissue, fatty liver tissue, tumors, tendon and muscle disorders. Those are the things that we're looking at. So the entire way we designed this is such that it's really easy to use for home users. The point of making this device that small and with the app is about the accessibility. So we look at it in three phases. The first one is cost, obviously. If you want to do it very frequently, it has to be quite cheap. So we're controlling it in hundreds of Hong Kong dollars per scan price. It could be lower as well, depending on what scheme we're looking at. And so that's one, the cost. And the second thing is the sort of location accessibility. This is something that we can send to your place. So it can be home-based. This is something you can operate your own. And that's why it's quite easy to access. You don't have to go to clinics. You don't have to go to hospitals for those sort of checkup. The third one is the sort of medical personnel support. Because quite a lot of those, even if you have a portable machine, not always you can operate without a nurse or a doctor. And the way we designed this, making it quite simple, you just wear it around, you follow the app, and then we can scan. It's exactly that you can do it yourself, or if there's elderly at home, it might be hard to operate a machine, your kids can help you with that as well. And that's the entire centric of the design. It has to be about accessibility. And then to enable this, we have machine learning algorithm developed by PhDs. So we have quite a few of us, we have 7 in the team. And then we are also partnering with 8 professors in Hong Kong We also have more globally that are running different trials on different demographics so that it can fit into a different population as well. But yes, the reason why we're doing machine learning is such that a lot of indicators can be automatically churned out within minutes for you to look at. And this is one example of how you can wear this at home. Essentially, this is a render, but with the product here as well. One example would be a government trial that we have done with the Hong Kong government, where we're monitoring recovered COVID patients. So after they got out of hospital, they have to be quarantined in a place for 14 days. What we did was we sent a device to them, asked them to do a 5-minute self-scan every day. Throughout the 14 days, we can monitor how they recover, look at left lung functions, and etc., so that we can have this sort of remote feedback. And this is really just one of the examples during this time. Obviously, we could do quarterly scans where you can look at your liver, lung, or kidney health quite a lot more regularly. Or it could be a bit more frequent, like weekly or monthly scan if you have known chronic diseases. So that's the model that we are looking at. We can do a more information-based telemedicine approach to enable quite a lot of the players inside the market as well. Yeah, so going back to this, we're looking at lungs, liver, kidney, but obviously there are other things that we're looking at. We mentioned tendon diseases. We're also starting in cancer and heart-based diseases, so basically the top 10 of killers in the high-income countries world. Some use cases. So on the left-hand side, we're talking about inpatient people in hospital. Outpatient would be, people outside. For inpatient, that's one good thing about what we do is that we can enable trend analysis. So using quite a lot of serious cases, for example, even with COVID, you stay in the hospital for a couple of weeks. Normally, you get one CT, or maximum 2. It's quite hard for us to scan quite a lot because you need to move the patient to wards, out of wards, and there's radiation, other consideration costs as well. But with that, we can scan really quite regularly. It could be done continuously for a couple of hours so that we can see the recovery in real time. It could be done, every day so that we can see a lot of more data points for us to have a fuller picture in terms of how the patient is doing. So that's one side. The other side, we look at home-based monitoring. So that's when we mentioned there are partners that we're working with, the big tech giants, private hospital, private clinics, where one example would be they do offer annual checkup plans for people to do scans themselves. What we do is on top of that plan, where they go into our clinics once a year, we send a device to them every 3 months. Every 3 months, we give them a week to test on it themselves. So they can use about everything we deliver to them. And after that week, someone would go to your place to pick that up again. So what follows is that we have reports that tells you what potential problems that you might have. For example, if you have a fatty liver risk factor, and then we'll do recommendations on how you manage those, what are consequences if you don't, and what are those exactly that could be developing in your body. And obviously, it's a really good tool to engage patients for the private clinics as well. And then that's what interested a lot of our partners, is that the patient engagement model, where you can do personalized healthcare. It's a really good digitalization. You don't require a lot more personnel to operate this, maybe a nurse or doctor calling you for 10, 15 minutes to do a follow-up. But at the same time, it keeps customer loyalty, and it's a very good engagement to have that continuous doctor-patient relationship. So that's for the private sector side. For the public sector side, it's really quite simple, because what we do is early diagnostics, monitoring. And what we can do is that we can put it in community-based centers, elderly homes or community centers, where you can screen masses of middle-aged elderly people, pick up disease early. And the main benefit of this is, other than just the well-being of patients, the overall healthcare costs, because you catch it early, the treatment cost is a lot lower as well. So that's how we look at the public and private sector separately. We've mentioned this a bit. It's a pay-per-scan model. We go for a B2B2C channel. So we give them tokens, and we send a device to people's home or inside the clinics, and then we count per scan. So this model, we have interest from 20 markets globally, we're expanding through those as well. So I'll end with 2 things. I will end with the user interface we have. and the clinical trials that builds on the trust of what we do as well. So user interface is quite simple. We go on the top left side where we look at, we tell people how to word about. And then the purple screens, we tell you how to do the test, essentially. So if it's a lung function test, we give you specific instruction in terms of how you breathe, because we've mentioned this is a really high frequency modality. We can look at pictures 30 frames, 200 frames per second. So that helps a lot if we follow the paradigm. After that, we can share the report to family, friends, doctors after your test. And then at the end of it, we give you indexes. That could be quite simple to understand. And there are articles that will follow up on that as well. So I'll end with the way we build trust medically. So whenever patients look at, or users, they have to have patients look at whether this is a trustworthy device. We look at 3 factors. The first one is whether this is a commercially sort of backed. That's why we're partnering with quite a lot of tech giants to partner with private hospitals, the reputable ones. And that's sort of first thing sorted. The second thing that they always look at is whether doctors would endorse this. And the doctors, from my experience, look at 2 things mainly. First one is whether it's practical, whether they have to learn an entirely new modality to understand what's going on before they can use it. And the second thing is whether it's accurate, it's sensitive, it's specific. And those, on the academic side, we're partnering with the number of professors as a start. But at the same time, the papers we're publishing are in high impact journals as well. And on the other side, whether they are something that doctors will be able to use quite easily, what we do is that we match those with medical gold standards, meaning that these are things that a doctor are normally already using. For example, if they suspect you have COPD, a very common lung disease that is chronic, they will ask you to do a spirometry as a gold standard. What we do is that we use our modality to benchmark the index against spirometry. And the correlation we have is really quite high so far. And that's how we can do the transitional, where doctors will be able to look at the indicators without learning the entire modality, would know what it means as a reference case. And that facilitates the entire process a lot sort of easier. Similarly, when we do liver, we do ultrasound-based scan on fatty liver and fibrosis. So and there's a correlation with the index as well, and similar for kidney, where we do different tests. So I'll end with this, and we'll welcome any questions after that as well. Thank you very much.